So everyone, so this is a continuation of previous lectures. So previously I talked about the late retraction, that how patient present to you. So normally the upper sclera normally not seen. So I will show you a picture about how the patient. Yes, this one is the picture. See, lid retraction. This we call lid retraction. Normally, there is, if for example, normally if someone looks you, so this upper sclera normally not seen. This one, but in the patient of hyperthyroidism, see, in hyperthyroidism patient, above the iris, you can appreciate the sclera. So this is the what? This is a lid retraction. This is a lid retraction while you ask the patient to look down, and you can see the sclera. This is we call lid like retraction. When you, and one is a lid retraction and one is a lid like retraction. So lid retraction, this it's mean what? Upper eyelid will be retract backward. Why? Due to the deposition of fats behind the eyeball in the hyperthyroidism patient. So eye looks like a horror movie like. So see, this is the upper sclera. In the severe hyperthyroidism or thyrotoxicosis, you can appreciate the upper sclera, which are normally not seen. Then also you can appreciate the palmar erythema. See, this is the palmar erythema which can present in the alcoholic patient, also in the hyperthyroidism. So this is due to what? Due to hyperdynamic circulation. So I am just talking about the low. So hyperthyroidism, one of the example can be Graves' disease. In the Graves' disease, what happened? Extra fat deposition behind eyeball. So this is a, you can say, hyperthyroidism most common cause is Graves' disease also, and iodine deficiency. So this is how the Graves' disease patient presents to you. So in the many patient of the hyperthyroidism can present as proximal myopathy. So proximal myopathy can be present in the rheumatological patient. Proximal myopathy means hip joint, shoulder joints, proximal muscles. But proximal myopathy can be in the hypo condition. It's not necessary, because it can be in the hyper. It can be present in hypo condition. So that condition also increase the metabolism of every cell. So more protein catabolism occur. As a result, what happened? Proximal myopathies. Now about other. So patient also on examination you will found heart rate is more than 100, that we call tachycardia. So hyperthyroidism is also a risk factor for atrial fibrillation. So if someone have atrial fibrillation or tachycardia, so we will check the thyroid hormones, either thyroid gland is hyperfunction or hypofunction. Then there is a lid lag retraction. Ask the patient to look downward. Also lid retraction. So we can appreciate the lid lag retraction mean when you ask the patient to look down. When patient looks down, you can appreciate the upper sclera. Also lid retraction. When patient looks you, so you can also appreciate the upper sclera. So normally it is not seen while patient looks down, but in hyperthyroidism patient you can appreciate. So patient also present to you with weight loss with increased appetite, because patient feel hunger every time, more eat but weight loss. And hyperthermia, patient body always hyperdynamic circulation, so body always hot. And palpitation, in which patient feel heartbeat. Awareness of the heartbeat we call palpitation. And patient also present to you with diarrhea, while in diarrhea can be differential diagnosis, irritable bowel syndrome. So diarrhea is also one of the one of the cause will be hyperthyroidism. And heat intolerance, patient unable to tolerate the hot weather, like in the summer patient can tolerate the cold temperature. So patient likes to sit in the cold temperature as compared to the hot temperature. So that's about the thyroid gland basic introduction, basic how the patient present to you. So how the patient present in the ward, and how the thyroid patients present to clinical features. So that's about for now. So in my next lecture I will talk about further about how to manage. So thank you so much for listening.